fortunate that we live in the United States. Very, very fortunate. Syphilis is making a comeback. Now again, we're talking about immigrants from all over the world. So you cannot point your finger at one immigrant population and say it's your fault. It's coming from all over the world. It's coming from Asia. It's coming from Africa. It's coming from the Caribbean. It's coming from South America. It's from all over the world. Okay, so just remember that. We've got 3 stages of syphilis: primary, secondary, and tertiary. Now, primary syphilis, the number one symptomology of primary syphilis is a painless canker on the genitalia, on the anus, or on the mouth. What's a canker? It's a sore. It's an open sore, and it doesn't hurt. And then you know what? Because it doesn't hurt, people don't come in to get treated. They just don't come in to get treated. Do you all know how Al Capone died? He died from syphilis. Yep. He died in jail. He was finally put in jail for tax evasion. Okay, but he died in jail from tertiary syphilis. And the reason is because he was so terrified of needles, he didn't want a shot. All it would have taken is one big old shot of penicillin, he would have been cured. Okay, but he didn't, he just was too afraid of shots. But he had this painless canker, didn't get treated, didn't bother him. Wasn't a problem as far as he was concerned. Now, do you all know about this man by the name of Scott Joplin? Okay, come on now. Scott Joplin was brought up in a brothel in New Orleans. Okay, as a little boy. He was abandoned by his mommy. His mommy was a prostitute. He was abandoned by his mommy, so he was brought up in a brothel in New Orleans. And he lost his virginity at the age of 8 or 9. But his only sexual contact, okay, during his formative years were with the prostitutes. And he contracted syphilis. He had this painless canker, okay? But it was painless, and it went away, so he figured, oh, well. Well, it was much later in life that when he got married, and I think he was in like the secondary phase. When he got married, he was in tertiary already at this point in time. His every single child that his wife got pregnant with died. Yeah, and it turned out they found out it was because he had syphilis. Okay, so we're not just talking about third world countries. We're talking about here too. You know, here from lack of education, lack of knowledge, people don't get treated. Like I said, pain is the number one thing that brings somebody in to be treated. This is a painless canker. So they're going to go, well, it doesn't hurt. And it's gone away, hey. Okay? It's cured by itself. So it can be on the genitalia, on the anus, or on the mouth. It occurs 2 to 3 weeks after exposure, and it resolves pretty spontaneously within about 2 months. It is very contagious. Very contagious. Secondary syphilis, well, you've got a rash, a maculopapular rash over the torso, over the palms and the soles, and this rash is extremely contagious, even through the rash. Okay? Secondary syphilis occurs about 2 months after the primary canker, and you get hepato or splenomegaly with this one. You could also see some generalized signs like lymphadenopathy, which means what? The swelling of lymph nodes. Okay, you might have some arthritis, alopecia, loss of hair, fever, malaise, weight loss, meningitis. Okay, with secondary syphilis also, there's something called condylomata lata that appears on the vulva. And what that looks like is basically cauliflowers. Cauliflowers on your vulva. Big old, I'm not talking itsy bitsy, big bunches of cauliflower on your vulva. Yep, I know, isn't that special? Then you go through a latent period. So you've gone through primary syphilis, secondary syphilis. Then you've got latent period. And during a period of latency, the patient is now asymptomatic, but it's still contagious. So remember, contagious in primary, contagious in secondary, contagious in latent. Okay? During the latent phase, the latent period, that person can have a recurrence of secondary syphilis. Then we get to tertiary. Tertiary is your final stage. It can occur years afterwards. Tertiary is the most dangerous phase, because this is the period where the spirochete now attacks your heart, attacks your nervous system. Okay, it can cause dementia. It can cause strokes, meningitis. It's a slow, progressive, inflammatory disease at this point in time. So it takes years. But like I said, this is Al Capone died of tertiary syphilis. He went mad and died. And the thought is that King George I had syphilis too, because he was going mad. All right. What happens if a baby contracts syphilis? Well, the baby will have hepatomegaly for sure. Will also have splenomegaly, and will have skin lesions. Okay. This baby will also get pneumonia. The baby will have hepatitis. So guess what we've got here? We've got a little baby with a depressed an immature immune system with all of these problems. His chances of living are pretty slim. Pretty slim. How do we treat syphilis? Well, penicillin. Essentially what it is. Penicillin or tetracycline if the person's pregnant. Again, remember I said to you before, we try not to give tetracycline, but if the choices are green teeth or death, you're going to give the tetracycline. Okay, so you'll give the tetracycline regardless because you want to take care of mommy and baby. We'll scrape what they do is they actually culture the canker and send that off for a test. For secondary syphilis, we do the VDRL or the RPR or the FTAABS, and that's basically, those are tests to find out if you have syphilis or not. Okay, any questions with syphilis? I'm going to go over it one more time real quick because I know that this is a question that does appear frequently in the NCLEX. You are contagious in the primary stage. You're contagious in the secondary stage. You're contagious in the latent stage. You are not contagious in the tertiary stage. Because it's already in your system. It is in your system. Okay? Contagious in primary, secondary, and latent, but not in tertiary. Okay, used to be a long time ago, what we feared the most was contracting herpes, right? We didn't want to contract herpes. Boy, that was the worst thing you could get. Well, today, if this is all you get, you're lucky from risky sex behavior. Okay. Herpes simplex virus, which is HSV, and you got two types. You got the HSV1, which is oral, and HSV2, which is genitalia. Okay, signs and symptoms of HSV. HSV2, we're going to talk about, the genitalia. Well, the vesicles appear between 2 to 20 days after exposure. All right? And they are little clusters, and they hurt. So that's your difference between syphilis and herpes. Syphilis doesn't hurt. The primary canker doesn't hurt. Herpes, you've got these painful clusters, vesicles that hurt. You get flu-like symptoms during the initial exposure. Okay, and these episodes of HSV2, the genital herpes, usually occur during stress or fever or menstruation. Now, we know now that we've got all these wonderful drugs that we can take to either slow down the eruption or to make it heal better. Well, what are your interventions for HSV2, your genital herpes? You culture. You give acyclovir, which is extremely expensive, and you give no sex, and there's no sex while the lesions are present. Now here's the thing. Anybody, any woman who has HSV2 will have a C-section. You know that, right? Because, why? Because these lesions could be internal and you can't see them. Now, I know of one doctor, one obstetrician in Florida, whose patient, we were laboring her patient, and she had a history of herpes, of genital herpes, and so I had gotten her ready for a C-section. I had the setup all done. I had the operating room set up, and I was all ready to go in. Okay, and the doctor says, no, we're going to deliver her vaginally. And I'm thinking, God, vaginally? And I said, well, remember she's got herpes? And the doctor says, yeah, but she hasn't had an eruption and she has no symptoms right now. And I thought, I really do not want to be a party to this. I really don't want to be a party to this. So I documented that I told the doctor. I reminded the doctor about the herpes, and I documented what the doctor said. And I was just praying that she wouldn't go into any form of extreme labor. She was in the primary stage of labor. I was just praying she wouldn't suddenly give birth or have to go to the OR, because I did not want to go in on this one. Okay? Because I'm going to tell you, I did a pelvic on a woman one time. When I went in and looked at, when you put the speculum and you take a look, it's usually that cervix just pops right out at you, and it's very obvious, and there's a little hole in the center of the cervix. Okay, a little dimple in the hole in the cervix. Well, no cervix. At least there was nothing with a dimple in the end of it. You know what she'd had? She had these great herpetic lesions, one great herpetic lesion that just completely covered the whole cervix, and it's all translucent and transparent. She did not have the first symptom. She didn't have the first one, and I said to her, "Do you have herpes?" And she said, "Oh, yeah, I've got herpes." And I said, "Well, you got one right now. You have an outbreak right now." She says, "No kidding." So you don't know. You couldn't tell looking inside. So essentially, for your purposes, and for NCLEX and for your practice, if your patient has genital herpes, that's a C-section. Okay, that is a C-section. All right. Condylomata acuminata, genital or venereal warts. It's caused by the human papillomavirus. And remember, if you have a history of the human papillomavirus, what does that make you? More susceptible to cervical cancer. So it may be a precursor to cervical cancer. Some of the signs and symptoms, well, you've got these little warts that grow all over your genitals and your labia, can be in your cervix also, or in your perineal area. And how do we treat it? Well, you know how when you have warts in your fingers, the doctor gives you this little acid thing that we essentially burn it off, right? Same thing here. Trichloroacetic acid, 25% solution. Okay, we apply that weekly, and hopefully the little wart falls off. We can also do cryotherapy, which is essentially to freeze it off, or we can do electrocautery. Okay? Laser therapy, lots of things. All right? There's something also called podophyllin, which is essentially a liquid that you just put on, and you leave it on very quickly, not for very long, and then you wash it right off. Interferon, we will give that as well. Okay. Now, the granddaddy of it all, if you contracted chlamydia and gonorrhea and trichomoniasis, okay, and all these other wonderful things, and you didn't take care of it, or you got multiple episodes of it, then you end up with PID. And when you end up with PID, you know that this is an infection of the upper female genital tract, and you have chronic pain, and it hurts. I mean, you're talking big-time pain. Infertility is your number one complication. Ectopic pregnancy is another one as well. Your signs and symptoms are that pelvic pain, and it usually is your adnexal pain. So pelvic, yes, but adnexal, meaning this both sides, your inguinal sides, okay, both sides. So you have severe adnexal pain. Person may have a temperature. In fact, most times they do have a temperature. Why? Because it's an infection, isn't it? Vaginal discharge. Oh, yes. Oh, yes. And if you think that trichomoniasis was bad, when this person has a combination of trichomoniasis, gonorrhea, and chlamydia, oh my goodness, bring out the Lysol. Spray the vagina right now. Okay, severe nausea, and the nausea comes from the pain. It doesn't come from anything else. It comes from the pain. She will have irregular vaginal bleeding. Okay? And sometimes this is what brings them in. Before they get the excruciating pain, they may have a dull pain before they get the excruciating pain. They will come in because of why? Because of the irregular vaginal bleed. So that's the reason that they come in. They'll have abdominal or adnexal tenderness, and they will have definitely cervical motion tenderness. And what that basically is that when the doctor does a bimanual, which means he puts those two fingers in, when he mobilizes, just pushes on the cervix like this is what we call a positive chandelier sign, because she'll be on the ceiling holding onto the chandelier. She'll be in that much pain. Okay? She will have an elevated ESR, and ESR stands for erythrocyte sedimentation rate. And generally, when you have an elevated ESR, it means you have an inflammation going on somewhere. Her leukocytes will be up. And why is this? Because she has an infection, right? So her white cell counts will be high. So what are your interventions? Well, you give drugs. You give lots of drugs. You give third-generation cephalosporins. You give clindamycin. And clindamycin, and you can give any one of these, IV or PO. Most times we'll give it IV, at least the first dose, and then send her home with a whole bunch of medications. We do ask people, we encourage people to use condoms with spermicidals. while they're being treated, because you don't want to be passing it back and forth. But a lot of times,